people and growing, so I think we should get at it because there's obviously a lot of interest. The intent, just so you know, is to provide a bit of information up front from Peterborough Public Health, just kind of cover the basics of the yellow zone and what that means. And then Matt Savino has a couple of specific HR things that I think he wants to share, likely around mask policies and that sort of thing. But I don't think that we'll spend too much time, guys, on that, maybe 10 minutes. And then we'll get into it because it looks like there's going to be some specific questions for everyone. I do want to say that it's obviously there's lots of controversy out there around all of the changes. Everybody has been, sort of drinking from the fire hose for the entire year, pretty much, and not everybody agrees on everything. But today is really not intended for any of that sort of thing. We really just want to stick to the yellow zone and the changes that were announced and how they affect your business. So if you can just keep your comments limited to the things that you need to figure out for your business, because in the end, no one on this call is really in a decision-making role. Some of us are in a role of influence, and that's okay. But I just think for us to get a lot done, we better stick to the subject at hand. So I hope you don't mind me saying that. We do have on the line Keith Beecroft and perhaps Matt Faris, Peterborough Public Health. Keith has done an amazing job this year. I'm sure he's part of a team, but keeping us informed and us, the business community, informed about all of the changes. They work a lot of late nights to get this information sifted and sorted out to the community. And Matthew Savino has Savino Human Resources Partners. He's also been extremely active in helping interpret what a lot of this means to everyone. I'll just ask everybody to mute your microphones just so that we don't hear typing and clunking and feedback and all of that sort of thing. Or Tiffany, if you can just mute everyone, and then you can just unmute yourself once we get to the Q&A. Those make for a lot cleaner presentation. So without any formal introductions, I'll just ask Keith Beecroft to start us off from Peterborough Public Health. Over to you, Keith.
Terrific. Thanks so much for having us, Stu, and for bringing everybody together. I think the last time that we chatted was roughly 9 months ago when everything was brand new, and I hate the word new normal, and that's what we were talking about then, but I'm starting to say when this is over, not if this is over. So if I can bestow any sort of hope to everybody on the line, it's that there is a light at the end of the tunnel. I don't have a date or a crystal ball, but with everything that we chatted about 9 months ago and everything that we've worked on since then, the light is at the end of the tunnel. And when this is over is kind of the lexicon that we're using right now, but we're not there yet. And I think that's evident by the yellow zone that we were here for today. The pieces that I was hoping to bring to the table, there are a handful of specific changes to walk through, and we certainly have all of that information on our website. And what I thought I would do too is send all of the links that we mentioned today. I'll send that to you, Stu, and then you can push out through your networks just so that people are able to listen and take notes if they want to, but they don't have to scramble for the resources. So the big one with the yellow zone is that by and large, customers in your stores won't experience too many differences. A lot of the stuff from the yellow zone is going to be impacted by the businesses themselves, namely that for meeting and event spaces and restaurants and places that serve food and drink, including supermarkets, salons, those types of places, fitness facilities and sports and rec, those types of places are going to require a safety plan. So that's really one of the biggest changes that comes through the yellow piece. The province has a template that's linked on our website. It's an editable Word document that you can use to fill out your safety plan. But what Peterborough Public Health has done is kind of taken the requirements from Regulation 36420, which you'll hear a lot about today, and turned it into a checklist. So as you're creating your safety plan, you can simply just walk through, yes, we've talked about screening, yes, we've talked about hand hygiene, yes, we've talked about physical distancing, and so on and so forth, and largely come up with a plan to make sure that the people that are visiting your stores and establishments are going to, benefit the most from these public health procedures, if you will. So that's the big thing, is those safety plans that are required, and we're certainly able to offer help to those that need help or want help or have questions about what's required in those plans. And the big piece with the safety plans as well is that they need to be posted or made available in some way that your customers can see it. So very similar to those in a restaurant establishment that would have their health check, their certification posted, whether it's online or through social media, or you have a hard copy that's on display. We would leave that to you, but by and large, those safety plans need to be posted. The other piece, I guess, that is a little bit new and different is that capacity limits at restaurants are changing slightly, in as much as only 6 people are allowed at a table. Last call is now at 11, and people have to be out of the establishment by midnight rather. And sports and fitness facilities now require a reservation system and more physical distancing and those types of things while you're there. So by and large, it's still status quo for the consumer as they participate or receive the services or products that you offer. It's just going to be a little bit on the back end from your purposes. I guess I should also note that there's one other piece that's new, and that's that if there's a staff member of your establishment that is going to come within 2 meters of somebody that's unmasked, so it's not spelled out so specifically in the legislation, but the only people that would really have an exemption within within the legislation, the way that this is described, is a customer at a table who's removed their mask to sit down and eat their supper. Servers are now required to have goggles on in addition to their mask as well, so that eye protection. The same would be true for people that own a nail salon or spa, where you're going to be within 2 meters of somebody that is unmasked. With all of that said, the key messages are still the same in terms of hand hygiene and physical distancing and wearing a mask and all of those types of pieces. The new piece here, and I think you probably would have seen Mayor Therian last night on Twitter with some of the comments around avoiding travel to the GTA. So that's certainly something that we're advocating for as well, is really thinking twice about the trips that you're making outside of your home, limiting it to, limiting the non-essential trips to those hot spots if you can, and really minimizing the contact that you have with those that aren't part of your immediate household. So those are the 2 big ones. The other piece that I'll send, Ottawa Public Health has a fantastic resource. This time of year is stressful enough for anyone, whether you're a business owner or a consumer or a parent or anyone really. With the added stress that's added because of COVID-19, Ottawa Public Health has some great mental health resources that I'll share as well that are specific to workplace strategies. And they're not over the top things. It really is about staff engagement and communicating expectations and recognizing that this sucks. I don't believe that this sucks is part of the public health lexicon normally, but it does. And I think we just need to be honest about our feelings and make sure that we're there to support each other. And Ottawa Public Health has some resources to get us through to that finish line. So I'll certainly share those with you. And I think when we think about capacity limits and safety plans and PPE, avoiding travel, that's my introduction. Perhaps Stu, if Matt is on the line, we can throw it to them and then get into the question and answer side.
Yep, they're both. So just while we're on the topic of public health, just so everyone knows, I did just post the link to the developing the safety plan. That's a provincial government website. So the link is there and working, and I'll check those other links as I can. And then Keith, if you or Matt can perhaps post the link to Ottawa Public Health in the chat group. It just is much more efficient if we can just get that to everyone today. Matt Faris, did you have anything that you wanted to add to what Keith just said?
No, I don't really have anything to add. Yeah, I'm happy to take questions.
Perfect. Okay, Matthew, are you ready to roll?
Yeah, just maybe and I'll be very brief with the slides, Stu, but just to reinforce what Keith just outlined really well. And Stu, you can see my screen okay?
Yep. Great.
So actually this is not going in display mode, but that's okay. So, I mean, we're only talking about the yellow zone. And the number one question we received from employers before the weekend was what changes on Monday? And I think Keith outlined that rather well. You know, your requirements are based on the types of goods and services you provide and the zone that you're in. For the purpose of this call, most of you are in the Peterborough region, the Peterborough Public Health Unit region, which is zone yellow. I know a number of you have operations that transcend into some of the adjacent regions like Durham, which is right abutted to us, move to red, for example. The number one thing that changed was if you are in a yellow zone or a region of greater restriction, a safety plan that Keith just referred to is required. We wrote about 30 of these over the weekend. So the 8 sectors, and I just want to make this very clear because this is I think a source of confusion for some employers. When this came out on the news Friday afternoon, every employer, some thought that they needed a safety plan for Monday. The safety plans are only required if you fit into one of these 8 sectors. So if you're a restaurant, bar and food, sports and rec facilities. So we have a lot of municipalities that have community centers and ice rinks. Peterborough Public Health, specific communications were sent out to them, which was fantastic. Meeting and event spaces, retail, but your retail has to be located in a mall. So if you're retail and you're not in a mall, you don't need a safety plan. I'm not saying you shouldn't be proactive, but there's nothing wrong with putting in a safety plan, even though it's not required. I think it's a great idea. And if you can append to that the checklist that Keith will post that PPH has developed, I'd highly recommend that. But suffice it to say, and the only point I wanted to get across here was really to emphasize that unless you fit into one of these sectors, you are not required. Doesn't mean you shouldn't think about doing it. So I won't go over the safety plan content. Stu and Keith have some links posted to that. Like I said, we wrote about close to 40 of them over the weekend. The government has posted a template. It's quite good. So if you just follow it there, and I can post this presentation as well. There are basically, I think 6 areas you want to address in that. And there's links all over the place, lots of resources on the PPH site, the government site. The government website is fantastic. It's just overwhelming finding what you need. Like there's almost too much information, which is not a criticism. It's just a reflection of the many dimensions that are involved with this issue. So as Stu said, wanted to keep this brief. Let's open it up to your questions and any advice or things that might be shared with your peers. Okay. That's all I have, Stu. Yeah.
A couple of things in chat. You can post your questions to chat if you're more comfortable with that, and we'll keep scrolling. We've got a couple of people on the staff on the line, so we can monitor all of that. But someone in Apsley wondering if the yellow zone affects them. Apsley is in the county, so I assume that's a yes.
Hi.
Yep.
Yeah, it's David here, hair salon in Peterborough. I just have a question regarding clients that are coming from like a hotspot into Peterborough because the businesses there are closed, and I'm just wondering about screening these individuals that are coming in from other areas.
Yeah, and totally well within your right as a business to limit whom is coming in and out of your doors. I might refer you to, I don't know, a human resources professional, if there's any on the lines that are consultants that could be able to offer with that, or perhaps, sorry, that was for you, Matt, or some of your own legal counsel. But the long story short is the public health direction right now, as far as the legislation is we're advising or limiting or suggesting. We don't have any teeth or legislation that says thou shalt not come from area A to area B, and we certainly know that that's happening. We know that it's a conversation that's happening. I know a lot of work sites with a lot of contractors coming in and coming out are asking that question. But as for the legislation and local enforcement, that would fall upon the business owner to come up with their own policies and procedures.
Okay, Matthew, have you got anything on that?
Yeah, I think that's correct. I think there's strong advisories from all of the health units in the government to wherever your zone is, whether it's green, orange, whatever it is, don't cross borders sort of boundaries for right now. You know, in Apsley, I know because we have clients in Apsley, and every time, you know, I go into Sayers Grocery for a donut, they know I'm not from there. So it's probably pretty self-evident who's in the local community and who's not. So I think exactly. So I think you want to insist on them following all the protocols you have posted for wearing, you know, PPE, including the masks and everything else. And it's going to become an increasingly sensitive issue and hopefully not a political issue, but I suspect
our concern, if I just may, our concern is that the screening that we have in place is not really, it's not, you know, like it's just very basic for everybody, right? We don't know where people are coming from or, you know, where their bubble has been or whatever, right? So I appreciate that input.
Yeah, I think the only restriction right now that we have within this screening is travel outside of Canada. I know that you've probably heard of the Atlantic bubble and the types of pieces that those
Yeah.
problems put in place, but with regards to Ontario specifically, there isn't any legislated restricted travel.
Thank you.
I think before we spend too much time on each question, Matt, this would probably cover a number of different scenarios. It really comes down to a person's rights as a business owner and whether or not you have the right to use service, including with someone who's wearing a mask or not wearing a mask. I'm wondering if you can help out with that just generally.
Yeah, I'll jump in and say one thing, and I'm not a practicing lawyer and I'm not going to give legal advice. I will say this, as business owners, it is private property. The next thing I would recognize is you cannot refuse someone service or entry based on a protected grounds of discrimination, right? So health, religion, gender, and so on, nor would you, right? But if you were to say, you know what, you're wearing a green shirt and I don't like the color green and you're not entering my store because you're wearing a green shirt. Green shirts are not protected grounds of discrimination. So again, you know, I'm gonna let the legal community comment on this because it's clearly going to become an issue that's in vogue. I mean, I think certain large retailers, like I understand Costco, I'll go into another topic here, but only brief. Costco forbids people from entering the store unless they're wearing a mask. If they have medical reasons for not wearing a mask, they insist that you wear one of those plastic visors. And if you don't, you're not entering the store, period. Now, they clearly have the resources to, if someone makes a human rights or other complaint, to face the coercive forces of the Human Rights Commission that most of us as small business owners do not have. But I won't speak for Costco, but I would think with some limited creativity that they are in a position to say, yep, you can't come into the store. Yep, you've got a disability, but we're accommodating it by providing you with opportunities to order online, take advantage of our curbside pickup. That's reasonable accommodation. What the Human Rights Commission will say about that, no one knows, because in my view, they're a pretty unpredictable regulator. That's my opinion only. So you will hear more about this in the weeks ahead, no doubt. And I'm going to leave it to the big players like Costco, and hopefully they will. I commend them for doing so, for drawing the line in the sand, and we'll see what happens.
Okay, Keith, did you have anything to unpack there?
No, I think nail on the head.
All right, great, thank you. So there's a couple of words or questions in chat, and we'll burn through them since we're on the topic of masks. I noticed there was a slight change of wording in regards to wearing masks indoors. Before, it explicitly said if you could maintain social distancing at all times, you could remove a mask. Does this still apply? For example, if I am at my desk in my own office space, do I need to wear a mask like I am right now?
Yeah. And that's a perfect example. So the 2 meters physical distancing piece is certainly part of it. And Matt Faris, jump in if I'm saying the wrong things in a second, but the other piece is being able to maintain distance from somebody else in a spot that's not accessible by the public. So if you're a warehouse employee, as an example, and you're stocking shelves and you're able to maintain physical distance from somebody else, you would not need to have a mask on. We've heard some folks in the downtown core referring to it as the mask and move policy that a lot of folks are employing, so that if you're at your desk like Stu is right now, he doesn't need a mask on. He's 2 meters from everybody. He's in a spot that's not accessible by the public. There's nobody around him. As soon as he were to get up and get his water bottle filled or use the lavatory, he would need to put a mask on if he's going to be out and about in those common areas where you're not able to predict whom you're going to come in contact with. There we go. Perfect.
This came up certainly for us in the early days, kids getting back into school, a staff person with a sick child, just a cold, etc. Is the staff member required to stay at home?
No. The short answer is no. If somebody basically needs to be contacted by a public health nurse and told that they are a high-risk contact, and if they're not a high-risk contact with specific instructions from Peterborough Public Health, they're largely able to go about their day. Obviously, we're looking for, I'm just going to mute my video while I find the email. We're looking for that self-monitoring and those types of things. But by and large, we've certainly had this question come up several times, and I'll find it for you right now.
Okay. While you're doing that, there's a couple of other questions that we can sift through. The guidelines for clients of ours who have breathing issues and feel they cannot wear a mask. A few of our senior citizens, for example, have COPD. And I think, Matt, you've probably covered that. I think in the end, it's largely up to each individual business person as to how they react, but just so that they know that they're within their rights to refuse service as long as they are providing some sort of accommodation, correct?
Yep, that's my understanding as well. Yep.
Okay. Yeah, we've got too many Matts on the call. Matt and Matthew, just so we know.
Yeah, I mean, Stu, I will clarify. My view that curbside pickup and online ordering is reasonable accommodation is only that. It's my opinion.
Fair enough.
It's other people's opinions in the field. This has not been verified or tested, if you will, against Human Rights Commission or any other formal process like that. But my thinking is Costco is taking that line in the sand with some research and thinking that they've got a right to do it, and I hope and expect that they do. So that's where we're at with that now.
All right.
Yeah, and just to follow up, this is Matt from the Health Unit. And yeah, when people are coming to us with questions with this, we're always pretty careful to say, please, if you have a friend that's a lawyer, if you know somebody that's a lawyer, if you know anybody that works in human resources, please touch base with them to see what they think about this, because we haven't received a legal opinion on this yet. And just because we received a legal opinion on it wouldn't mean that would apply to everybody else. So it's really, unfortunately, falling on the small businesses again to look into that.
Lindsay, if you wouldn't mind, if you could just have a quick search and see if there's anything out there that seems up to date and relevant. I know in the early days we were posting a couple of legal opinions, but it was March, maybe April at the latest. So it would be interesting to see if there's anything online about that. I mean, many of you can certainly Google it the same way, but just trying to be helpful.
I've got the answer here. Sorry, I'm just going to jump in.
Yep, go ahead.
Child has symptoms. Does the rest of the family need to be tested or self-isolate? Can siblings go back to school? Can parents go to work? Answer: all household members of the symptomatic child are to self-monitor for 14 days. They can continue to go to childcare, school, or work as long as they have not developed symptoms themselves and as long as the ill child has not been diagnosed with COVID-19. And that's a chat feature for you as well.
All right. Are you getting that from your website?
It is, yep. And the link is there. It's a PDF about it's labeled aptly sniffly nose, child with symptoms. That's my own words, not our professional public health nurses, but that's the PDF that's linked just shortly.
Good. All right. Just so everyone knows what Keith is, I almost called you Matt, what Keith is looking at. This is the Peterborough Public Health website, and it really is a great resource with a lot of links. The FAQs, face coverings, links on the safety plan. This is the provincial government website here on how to create your work safety plan. It's just, more stuff that you have to plow through, but just so you know, the resources are out there. And these links, as I mentioned, are in the chat, in the email that we sent out Saturday and on our website. So let's get back to the questions. Lots of sectors covered, certainly lots not. Someone asking about construction, seeing nothing about construction in any color zone, and somewhat surprised to see this, but feel they have a wide attitude to interpret constraints as I see fit. Yes?
Yeah, I think for us, the black and white is OREG 36420, and if it's not captured there, then it's those same general compliance measures that we're looking for. Broad, very, very, very broad strokes, but the outdoor construction sector would obviously be safer than the indoor construction sector. But again, if there's very specific questions, we're happy to answer those. If they're not covered, it's not the law.
The next one is about more clearly defining a meeting space. And I think you touched on that by whether or not it's accessible to the general public. So if you can just flesh that out a little bit.
Yeah, and I think the notion right now, there used to be a little bit of latitude there, but if you're in a boardroom or a conference center or whatever the other space might look like, it's still maintaining that 2 meters between each other, but a mask is required even if you are maintaining that 2 meters distance. There aren't exemptions for meeting spaces in the regs.
Here's one for you. A very specific question. A retail spot with a salon liquor license. Where's that? We take contact info for haircuts. Do we need to, if someone just comes in for a beer with no cut, do the glasses on employees apply to us? I hate to laugh, but it's new to me. So
Talking to another guy that does his haircuts in his bathroom. I got
anyway,
Matt,
can you decipher that one, Keith?
Yeah, I might turn that one over to Matt Faris.
Okay, Matt.
Yeah, and I think in that instance, it would, since you'd also be considered a food premise, and I think I know what place we're talking about here, you'd also be considered a food premise. So if somebody's coming in to eat a cookie, sit down, have a beer, sit down, drink the beer, you would need to get their contact information.
Okay, great. Does that answer your question, Mike? I just figured out who that was. That's at Providence, just in case you want to go in for a beer and watch someone get their hair cut. Okay, can we make staff wear masks rather than shields? We have 2 people who do not like masks and are wearing shields.
Matt Faris?
Yeah, we're kind of looking at the shield as something, if you're truly exempt, you don't need to wear a mask because you've got a medical condition or goes against your religion. We're looking at face shields as a better than nothing alternative, but it's not an alternative if you can wear a mask.
Stu, the other thing I would say that I would draw a line of differentiation between customers and employees. So at the end of the day, the employer has the obligation and the right to determine what's safe practice for the workplace. So it's a little bit different than the customer scenario. So if you determine that masks based on PPH or other advice is the safer protocol, I think you have a right and beyond that a responsibility to require it, subject to any kind of medical documentation that would suggest and that's not hard to get, by the way, that would suggest that the employee has a condition which precludes them from wearing a mask.
Food service, if I'm serving and less than 6 feet away from a customer with no mask, I am wearing a mask, number 1. Does my eyeglasses count as eye protection? And 2, if I'm wearing a face shield, do I still need a mask?
So masks and face shields are meant to be worn in conjunction with each other. The analogy that I often use is that your truck has airbags, but it also has seat belts, and they're not meant to be used independently. So the short answer is yes, a mask is required all the time. The second part, we're looking into the piece. I know that we've had some questions come in from other workplaces with those little safety shields that snap onto the arms of prescription eyewear. So the short answer is we don't have an answer right now, but we have sent that one off to the Ministry of Labor to see if they have an interpretation of whether or not that would suffice, and we can get that back to the group when we have an answer. I don't know if you've heard anything since then, Matt Faris?
I haven't heard anything since then, no.
It sounds super weird when I refer to you as Matt Faris, but I promise we were more friendly than that day to day than Matt.
I appreciate it.
Is there a differentiation there between glasses and safety glasses?
I think that there would be, just based on the added protection that safety glasses would have. So that's what these little contraptions are that we're looking into that can kind of convert prescription glasses into safety glasses, and whether or not that would be compliant.
Okay. Question from a fitness center wondering if their gym equipment needs to be a certain number of feet apart.
Matt?
Yeah, I would think that in the weight and exercise area, there's different requirements. Like now, if you're in an actual fitness class, the class can't be bigger than 10 people. That would be the maximum in the class, and those 10 people have to be spaced out by at least 3 meters. In an area of the gym where there's like weights, stuff like that, people would just need to be able to distance themselves at least 2 meters from other people. So the distance would be 2 meters.
So I think the big one there is that, you know, things like treadmills and spin bikes and rowing machines and things like that would likely need to be moved a little bit now if they haven't already. But if there was a standing stack of free weights or other accessories, if you will, that if it was a central place that the person was able to take it to within the facility to give themselves that distance.
Okay. As a farm with pickup at our home during the winter, do I need to take customer information such as name and phone number?
No. No, you don't.
Okay. If there are any other salon owners, could we create an online resource to chat with each other regarding public health protocols? Great idea. Knock yourself out. With that, we'll just leave it up to you guys to connect. You can just private message each other in the chat. From Katie and Brad Watt, food service, those serving guests that are not masked that now must wear eye protection, are cloth masks still acceptable? Maybe you can cover, Keith, the difference between a 2-layer and 3-layer mask. Right?
Yeah.
Yeah, so I'll jump in with the 2-layer and 3-layer piece, and then Matt Faris, if you want to take the rest of that one. So the guidance from Health Canada now is that they're recommending a 3-layer mask, but at the same time, we're not advocating that people throw out their existing 2-layer masks, provided that that mask still fits snugly and securely. It's kind of like, you know, socks or underwear or a new pair of pants. Don't get rid of it until it's time to replace it. Many 3 or 2-layer masks can be adapted and have a 3rd layer installed. But by and large, we've done a quick scan of all of the big box stores, a lot of the online retailers, some of the ones downtown. And from what we can see, many of the stores are now selling almost exclusively the 3-layer mask. So it's becoming the norm. But with regards to the efficacy of the 2-layer masks, please don't throw them out yet, but just think about replacing them with the 3-layer ones when that time comes. And then to the PPE requirements, Matt?
Yeah, and the big change with the PPE requirement, I just want to be clear, we didn't make up this at the local health unit level, but it has changed. So early on, it was just cloth masks should be fine. With the recent update of the regulation, now it specifically says PPE, personal protective equipment, and a cloth mask is not looked at as personal protective equipment since there's so many different possible designs of a cloth mask. So we're looking, it needs to be specifically a surgical mask or some kind of medical mask. It doesn't need to be like an N95 or anything like that, but just one of those rectangular masks that cover your nose and your mouth, and eye protection. And that's if you're providing services for people that aren't able to wear a mask and you have to be within 2 meters of them.
What is the capacity limit for office spaces? We have 2 boardrooms and 10 single private office spaces. So capacity limits?
Capacity limits haven't changed. I guess I should preface that by saying that, you know, first and foremost, our recommendation is that you should work from home wherever possible, even if that means that the trim behind you isn't finished yet from a renovation that you started a few months ago, but working from home is still the preferred option. And capacity limits really don't apply to businesses and workplaces with the exception of the physical distancing piece. So being able to modify spaces to accommodate for that. But from my knowledge, we don't have capacity limits on office space the way that we do at another facility.
Okay. From a mechanic's shop, are our mechanics required to wear a mask while working?
That would again get back to the piece in terms of accessible by the public and whom they're going to be in contact with. So if it was, I'm thinking of getting my oil changed and I can picture the truck in the service bay. The area is not accessible to the public. Presumably the mechanic is able to work on that vehicle by themselves. In that case, they would not need to have a mask on. But if they were to do something where they were going to be, you know, leaning in head to head, working on something together or what have you, then the mechanics would need to have a mask on if that 2 meters can't be maintained.
Okay. And just so everyone knows, what we will try to do is capture all of these questions in chat, and anything that we don't get to, I'll just flip it to the health unit and see if they can answer anything specific, and I'll try to sift out something that's already been answered. And just to save me from reading the entire question, everyone can see this in chat, so it's probably not all that compelling, but Keith or Matt or Matthew, if you want to read ahead, then you might give you a chance to look up a link or that sort of thing. And we'll just go as long as everyone's interested or available. So carrying on, Singa, what is What about a pop-up setup? We were planning to have customers wait sitting 6 feet apart in the room and wait standing 6 feet apart. We're going to have everyone use our hand sanitizer. We're also requiring a mask. Is that enough?
Is this a retail environment? Sorry.
Yes.
And that's to manage the distance outside. Is that what I'm getting from the?
Calling it a pop-up, and Zinga, if you want to jump in to clarify if you need to.
Sorry, I was on mute.
That's all right. Go ahead.
It's a one-day sale inside.
So a pop-up inside a store?
Inside any space at all. So
Okay.
in this case, it's at a church.
Okay, so we're not in the process right now of approving these kind of one-day craft sales. There was some communication that came out from the health unit about 3 weeks ago, and I know that this is the time of year where a lot of folks are looking at, craft and bake sales and different types of things like that. But that direction came from our executive and our leadership team at Public Health, so we're conveying that to primarily. Sorry.
I'm sorry, it's not a craft sale. It's just it's a one vendor, 1 day pop-up. I don't know how to explain it. It's
clothing. It's clothing, right?
Yes.
Okay.
Perhaps what I'll do is I'll put my contact in the chat and we can connect on that one offline and problem solve that one together.
Good
Okay.
idea. Yeah.
Thank you.
Okay. Keith is posting some answers and links here, so you can all just have a look at that. And Sean is asking, will company policies override Peterborough Public Health with regards to a sick child?
So the short answer on that one is that without deferring back to the regulations, I'm going to defer back to the regulations. And the regulations that are 36420 and the different direction and instruction that Peterborough Public Health has issued are what we would consider the bare minimums. And then for specific workplace policies and those types of things, we would refer you to your union or your HR rep or your legal or your whomever it might be. But provided that the bare minimums with the regulations are being adhered to, whatever policies and procedures specific workplaces have come up with, as long as they also meet the bare minimums would be what we would defer to.
Okay.
If Matthew has anything else to add to that one?
Yeah, I think that's exactly right. You can, just like any other employment or minimum standard, you can exceed it, with those usual caveats about ensuring it's not exceeding it in a way that offends some kind of human rights code issue or might be construed as constructive dismissal. I mean, there's a million things, but generally speaking, you can exceed minimum standards.
It's 22. I think we'll just do a temperature check at 11, which is an hour into it, and we'll just see where everyone is at, and we'll just carry on. Cool Cat would like to make some comments on accessibility. Go ahead. Just keep an eye on the clock.
Hi, Stu. It's actually Jason. So this is my daughter's sign-in sign. So
I was wondering, but go ahead, Jason.
So I'm with the Council for Persons with Disabilities, folks, and over the summer we spent some time visiting a lot of local businesses, handing out a tip sheet on how to be more accessible during COVID-19. So with our yellow status now, I just want to encourage businesses to continue understanding about the accessibility needs of our community. So we encourage businesses to do things like dress up their sanitation stations so they're nice and bright when people come in, they can see where they are. We always encourage updates to be posted on websites to make it easier. We also make certain suggestions around face shields, and what we're suggesting is if you have a face shield on hand and you have a customer who comes in who is experiencing deafness or hard of hearing or maybe some other communication barrier, that a face shield might allow you to interact with that customer and communicate a little easier. And again, it was already said earlier about the shield is more of a best scenario versus the mask, which is the better solution. But again, when it comes to communication, sometimes that's a real need for a lot of our community in terms of accessibility. The other thing I just want to make mention of too, folks, is that there are people who are living with different types of disabilities who just simply cannot wear a face shield or a mask. And I know that there are company policies and then there are HR policies around face shields and masks, but just keep in mind, there are people out there who just simply can't. And some of them, there's been a couple of major articles over the last couple of weeks here about refusal of service by corporate industries to children who have like autism and other major needs. And it's a shame that they're causing so much grief for these individuals who simply just can't. So I know it's discretionary, but just bear that in mind when you have a customer who comes in, and best discretion if possible.
Yeah, discretion is a great word. I appreciate it, Jason. Thanks.
And I think at the end of the day, one of the key messages is that we're really trying to get out there as well. And it often gets lost, but we need to do a better job at it. And thanks for the reminders that we just need to be kind to each other. We're like, everything I can say is a stereotype and a cliche. We're in this together. We need to work together, all of those types of things. But at the end of the day, we just need to be kind to each other. And I think that's certainly part of what you were addressing.
Absolutely. And we know that there's been a lot of work put in to creating COVID policies for companies. We respect that. It's just our hope that some of the tips that we provided when it comes to accessibility, that they're simple, easy things, and if we can incorporate that into regular day-to-day things, then it just increases the accessibility for everybody, not just people living with a disability.
Yeah, one of the things I saw to that end, and I haven't had a time to share it yet, but it's going to be going out in one of my updates. 5 Counties Children's Center posted shortly after Halloween that all of the candy chutes that were developed, and they were kind of a novelty idea, but with using the PVC tubes to get the candy safely from point A to point B, which was awesome. But at the same time, those candy chutes made trick-or-treating accessible to everyone, regardless of abilities.
Absolutely.
So when we're thinking about, those day-to-day things or those special event things, let's not toss out those candy chutes, because all of a sudden that stairway wasn't a barrier to a kid that wanted to go trick-or-treating. So little things like that, I think, are things that we all need to do better on. That's great.
Excellent. Okay, moving on.
Thank you.
Kaylee, I'm not sure if this has been answered, but Kaylee is in the hotel business and looking for some clarification around staff that are in and out of areas where we know people aren't necessarily wearing masks. Should we be issuing safety eyewear, and is there a specific eyewear they should be wearing?
Matt Faris?
Yeah, so if staff need to be within 2 meters of people staying at the hotel or motel, yeah, and they're accessible to the public, then they should be. And it doesn't say specifically what kind of eye protection should be worn, but we do know that typical glasses are not enough. Like Keith said earlier, there needs to be something along the sides to protect your eyes as well.
Holiday Inn wants to know, this is a good one, if there's limitations or physical distancing in their swimming pool.
Matt Faris?
That's an interesting, I would have to look into that. I haven't dealt with any swimming pool questions in a while.
All right.
But I know in any kind of space where there's like physical activity going on, like any kind of sports or recreation room, everybody, the main thing is everybody needs to be able to maintain a minimum of 2 meters between. So since every space is different, it might be that there's no more than one single family can use this pool if it's a small pool at a hotel.
Right. Okay. Maybe it depends on whether you're under the water or above. If just trying to keep it light. If clear plexiglass shields are directly in front of employees' workstations, can the employee not wear masks so customers can fully understand the employee, or are they still required to wear masks behind a shield? Good question.
Still required to wear the mask. I think we would get back to some of those accommodation pieces that are certainly there. And I think by and large, if somebody was pulling it down briefly to instruct on how to use the pin pad or answer a question, that's certainly one thing with the accommodation side of things. But generally speaking, if it was a retail environment or a convenience store or something of that nature, the mask is now required regardless of the plexiglass installation.
Okay. Is contact tracing information required per guest or per household?
In what setting?
I don't know. It looks like it's Katie and Brad Watts, so it's likely a restaurant.
So that has just been, that's another one of the changes in the yellow zone. It's everybody.
Okay.
It's not just one person per table.
Okay, great. Perfect. Cynthia, where are 3-layer masks available? I'm going to say pretty much everywhere. I think you just have to read some labels. Our website has an updated list of PPE, the retailers in the area. I'm not sure if you're doing that as well, Keith, but I know our website is pretty up to date. And as Keith mentioned earlier, people are essentially just switching over the retailers. So I don't think it will be hard to find, but I don't have a specific location for you unless someone on the line just wants to jump in.
And I don't think you've done yourself a big enough service there. We use that PPE portal all the time, Stuart, and all of our inspectors are going to be going out to the restaurants and other inspected premises in their area. And that's one of the websites that we've equipped them in their toolkit to support business owners is to go to the chamber portal. A quick scan, we've seen the 3-layer masks everywhere from Dollarama to Costco, Old Navy, Home Depot, and wherever else you might find masks. It seems to be the norm now.
I'll also say, Stu, that we actually included your PPE equipment on our tip sheet that we handed out to 675 businesses this summer.
Perfect. Thank you. Thanks. Yeah. Sandra Dueck did a ton of work on that all year on keeping that up to date. And we're going to try to continue to do that. Is there anyone on the line right now who sells 3-layer masks? Just unmute and jump in. I'm seeing links here for Amazon and, you know, other places. I'm just wondering if there's someone local.
Sorry, it was either Jay or James or Cool Cat. If you were able to send us the accessibility work that you did, we would love to have that in our back pocket as well.
Absolutely. I'll send that to Stu. It's Jason, but thank you.
Sorry, I was half right.
No problem.
Jay.
Hi there. We sell 2-layer masks that you can put a filter in.
Right.
Terrific.
Yeah, that's good.
2 layers?
Okay, that's Zynga, just so you guys know.
Great.
Zynga.ca.
Thanks.
Okay, drivers traveling to gray zones or red zones for delivery, what protocols are in place?
Yeah, so for that one, we would certainly, that would fall under the essential travel category. By and large, the work that, or the wording that we're using right now is the non-essential trip. So whether you want to go to a fancy restaurant, although I might suggest that there's lots of fancy restaurants that are better than Toronto, downtown Peterborough, or visiting family, those types of non-essential trips to a gray zone, we would avoid at all costs. But certainly delivery drivers and other people that are traveling for work would have those exemptions, obviously. And we would certainly just defer back to the tried, tested, and true, the masking, the physical distancing, the hand hygiene, self-monitoring. Before everybody goes to work every day, you should be self-screening or screening yourself in with one of the ministry tools, or however your workplace has got that set up. So take care of yourself, take care of each other, but there aren't any restrictions for travel at this point for work.
We've worked our way through the chat questions. I'm going to open it up for anyone who's got something specific that they want to add or ask. Recognize that there's 53 people on the call right now, so that can turn into a bit of a shit show. So let's just be kind to each other, but just jump in if you've got something, and I will scroll through and try to find if you've got your hand up or you want to indicate, you know, raise your hand in the reaction using the reactions tab. But for now, if anybody's got anything that they want to ask or add, jump in, or we'll start to wrap it up.
Perfect. And I see one there for drivers that do not come into the building. So the screening is really meant for people that are going to be spending a prolonged period of time in your building, whether it's a volunteer or a contractor or a service person, somebody that will be providing work or some such other thing for more than 15 minutes, really. But if it's Purelator or FedEx or Canada Post that's just popping in, those drivers do not need to be screened. You would just want to have those passive screening posters on the outside of your door, so that as they're coming in, they can, you know, just reaffirm that, no, I don't have the sniffles, no, I haven't been somewhere, and it's safe for me to come in.
Okay. Are there 3-ply disposable masks? Anyone know the answer to that?
Yeah, I think we definitely found some of those in our scan, and for lots of reasons, they're great for somebody that wants to keep them by their, you know, retail establishment door. For somebody that has forgotten theirs, they can just, you know, conveniently give them a disposable one. For the environment, not so much, but certainly there's a time and a place to use a disposable one. And yes, there are 3-ply disposable.
All right. Anyone?
I just sent you that tip sheet on your email.
Okay. Thanks, Jason. All right, last call. Any other questions or comments? Okay, great. Thanks, everyone. Really appreciate it. Hopefully it's been an hour well spent. I think it has, Keith and the Matts. Really appreciate you guys volunteering with your expertise as
Thanks for bringing everyone together. And I think I might just close by saying that Michael Leavitt, he was the Department of Health and Human Services in 2007, and he said during a pandemic, everything that we do at the time is going to seem like overkill, but when it's over, it's going to seem like we didn't do enough. So we know that you guys are under immense pressure to meet these regulations and these changes and so on and so forth. But at the end of the day, it's really that health and well-being and trying to avoid, you know, preventable deaths throughout all this. So from the health unit, thank you to every single one of you on the call right now. We know it's not easy. We know we're asking a lot of you, but it is making a difference, and this will be over. And it's all of those little things put together that is going to get us to the finish line. So thank you.
You're welcome. Well done. I think that's a wrap. Thanks, everybody. Take care.
Take care.